Good morning. Welcome to Iowa Ideas In-Depth Week. This week's focus is on mental health, and today we will be talking about what's driving the increase of mental health needs in younger populations. Before we get started, I want to thank presenting sponsor ITC Midwest for their sponsorship on all things related to Iowa Ideas in 2024. And thanks to this In-Depth Week presenting sponsor, Foundation 2. Joining us today is Alissa Doobay, Director of Clinical Services at the Scallion Center for School Mental Health, Dr. Hanna Stevens, Head of Child Psychiatry at the University of Iowa Hospitals, Megan Isenberg, Education Director at Fort Oaks, and Tawny Schafbuch, a school-based program manager at Tanager Place. And my name is Grace King, and I'm the K-12 education reporter for the Gazette. A reminder to our audience, you can submit questions through our discussion in the Q&A at the bottom of your screen. And thank you all for being here today. All right, panelists, let's start by, could you describe your work in the mental health field? Alissa, would you like to start?
Sure. Thank you for the introduction. I'm the Director of Clinical Services at the Scanlon Center for School Mental Health. And we are a center that supports mental health and wellness for students and educators and school staff in K-12 schools across the state. I direct the clinic, which has been open for 2 years now, and we provide services that include telehealth, individual and group counseling that are delivered at school for youth. We also have those services available for the educators. We also provide support following crisis events, so post-crisis support for school-wide crises that happen. And we are engaged in training, both in terms of current educators who might need some support in learning more about suicide intervention skills or other mental health related skills, and then also training graduate students who are interested in pursuing a field in mental health.
Tawny, would you like to talk about your work?
Sure, thank you. Yeah, I am the school-based program manager at Tanager. If you're familiar with Tanager, we offer a wide variety of services for children and families. My direct oversight, though, is the school-based program in which we provide school-based therapy and BHIS, behavioral health intervention services within the school setting. So while we do direct care with individual, family, group sessions, we also provide a variety of different preventative services within the school buildings as well to support the school building, the educators, all of the people that are involved in this children's life. And so what that might look like, it could be attending meetings with student support, IEP meetings with families. Could also include classroom observations and consultations with teachers to talk about the behaviors and things that they're seeing in their classroom and how to build better relationships, connections, and address some of the behaviors. We also do some training pieces within the school districts and school settings. That could be something about just appropriate developmental milestones and behaviors. It could be youth mental health first aid, lots of different trainings that we offer to educators. And then we also can run some enrichment groups. We do some self-care sessions. Again, any of those preventative things to help keep the school system, including the kids, the parents, the educators, all healthy and maintain a positive well-being.
Dr. Stevens.
Thanks, Grace. It's so nice to be here. I'm from the University of Iowa at the University of Iowa Healthcare. Here in our Division of Child Psychiatry, we do a lot of work with direct care and acute services for inpatient mental health problems, emergency, outpatient, group-based kinds of care. But all of our people in our division do a lot of education of physicians, of medical students, of psychologists in training, and our colleagues in multiple different medical areas, which we're very proud of our collaborative spirit over here. And here at the university, obviously, we also do a lot of research in the area of improving services and improving our understanding of mental health problems for young people. Thanks.
Megan?
Hi, everyone. Megan Isenberg. I'm the Director of Education Services for Four Oaks, and that looks like a variety of different services, including everything from coaching educators within the school setting on how to create and maintain a safe, predictable environment, how to respond to mental health needs of students, supporting educator mental health, and then providing some direct care services to kids and students within school settings, such as wellness programs that are targeted on reducing substance use with older students, and then services that range all the way up into therapeutic classrooms for students who have high level mental health or behavioral health needs.
That's interesting. Thank you all for the incredible necessary work that you do. How do you see mental health needs growing among kids and young adults? And Tawny, would you like to start?
Yeah, so I think it's a number of things. When I was sort of preparing for this panel, a couple of things that I think I wanted to touch base on specifically was I don't know that the needs are certainly growing. I don't know that they're changing. We sort of talked about as a group that a lot of the things that we're seeing in kids are things that have been around for quite a while. But now it's more and more kids that are seemingly being impacted by these things. And some of those things that I feel that we see a lot in conversations with the schools that we're in partnership with and our therapists that are doing the direct service work, a lot of influence by social media. Again, like at any age, really, at this point, kids are getting phones sooner and sooner and having that access to social media, which in general just, increases that influence on kids. So, and it's harder to set boundaries around some of those things, as we know. And so having that access sort of all of the time can contribute to a number of things like cyberbullying, comparing ourselves to our peers. If we're already having some, disagreements among peers and peer conflict, that can continue on through those social media platforms. And so really, I feel that kids are having a harder time managing some of those feelings that come along with the social media aspect, such as the anxiety of what do I look like in this picture? How am I being portrayed in this way? Even loneliness, where it feels like you're connected online, but in real life, I maybe don't have a person that I can touch base with. And then we know can also increase, levels of depression and things like that. This is something that I talk about a lot in working with middle school, high school populations is how do we set better boundaries about, technology, social media, and those things, because we are seeing more and more things that are popping up as it relates to the use of social media and how it's impacting our young folks.
Yeah, would anyone like to bounce off of Tawny's ideas?
Sure. Something that I'll add to that is, we see very similar, but something we refer to a lot is what we refer to as the window of tolerance, where, again, because kids are really struggling with real social connections and there's a lot of social media dependency, they're lacking some of the skills of being connected in a more personal way. And so then when they are in those environments, they are really struggling with just a level of overstimulation and lack of skills to be able to cope with that. And so their window of tolerance is really small and they're not able to kind of navigate through some of those more challenging situations. The other thing that we see a lot of is just kids, again, it's not necessarily more kids, but it's kids who previously, thinking about a couple years ago, families, connections they had previously would have been enough of a support system for kids to manage through things in a healthy way. But for whatever reason, as the environments change, that social media dependence, they're struggling more now than what their current support system is able to provide them. So we're seeing some of those kids reaching out for services or needing more supports where, a few years ago, the supports of their friends, families maybe would have been enough for their needs at that time.
Dr. Stevens. Oh, yeah.
Yeah, I'd love to jump, or Dr. Doobay.
Oh, go ahead.
So I just wanted to dovetail off what Megan said there, because I think that kids do pick up on stress of the adults around them. And I think adults have been going through a stressful period here. We don't want to rehash our experience of the pandemic, but we're still coming out of that and people are still finding their new normal, I think, in terms of adults and taking up new jobs and setting up their communities the way that we have had it in the past. So I think that perception of stress, but the one thing I wanted to really make sure to mention was that there's a positive in this too, that there's decreasing stigma for young people and all people to talk about the mental health struggles they're having. And people are more willing to talk about it, to seek care. And that I think we should all, I think we all believe is a good thing, that people are willing to ask for help when they need it. But it does make that appearance of, and reality of we need to be able to provide more help for kids. But that increase in willingness and ability to talk about mental health is a really wonderful thing that we're seeing in our society right now.
Yeah, I agree wholeheartedly with the responses that have been provided. I see a lot of just this sense of isolation, which I think goes back to what everybody has already said regarding, being on all the time with social media, but not really connecting with people, having maybe a not realistic view of what's happening in other people's lives and what our lives should look like. I think that reducing that tolerance for what is it like to feel discomfort and distress and to be able to cope with that and learn and grow, as opposed to feeling like something's terribly wrong with me if I'm not feeling happy all of the time. I also think that there are groups of kids who validly feel unsafe in different environments, and we've seen, I think, increased polarization on different ideologies and viewpoints that have made it hard for kids to know who can I trust, where do I feel safe, and that feeling of safe connection, especially with adults, is just so vital to well-being. So those are just a couple other thoughts that I had.
Thank you. Yeah, how can community members and families help support kids' mental health?
Yeah, I see in one of these questions here, wondering how to, maybe not having an issue that you need to address right now, but if something was to come up, like wondering what to do. And I think we do have some really wonderful resources of like everyone's pediatrician, even when kids turn 18, often can continue to seek help from their primary care provider and ask for help there. A lot of times those providers will be connected with other providers if they're not the right person to seek that help with. But then there's a wonderful mobile crisis program that has been developed across the state of Iowa, and that can also be a place to seek advice and ask for whether mobile crisis actually, assisting is appropriate, and if not, are there other things to do? So those are a couple ideas. I'm sure all my colleagues have great thoughts too.
Yeah, I think that mental health literacy of knowing what's available, how to access those things. So knowing about 988, the suicide lifeline. I know a lot of schools on their back of their badges, they even have information about crisis resources for the students to be aware of. And I think also continuing to reduce stigma so that individuals feel like if they're struggling with something, there are people they can talk to. There are people who will validate and understand what they're saying and help them access those supports. Making safe spaces where kids can go and connect with people.
I would support everything that was mentioned because there's a lot of value in training, but something else that I think community members can do is just to focus on the things that they can do with skills that they already have, like simply engaging and connecting with kids and families in a kind of real life way. So more of that intentional relationship building, something as simple as, greeting someone, saying hi, doing regular check-ins, just to, again, preventative measure for kids to feel safe and feel connected to people, because that could very well be what they need to feel supported to take that next step to ask for additional support.
Yeah, I would agree. I echo all of these things. And I think one thing I always want people to know is some of these, you do not have to be trained as a licensed professional to do a lot of these things, right? Like you can promote mental health by just engaging in positive coping skills, being open communication, and talking about mental health, reducing the stigma that way. helping kids and families build resilience by helping them, work on problem solving skills and developing their own self-efficacy and these things that we probably are doing as humans already, whether someone has helped us along the way or we've been taught through our own education, but just really kind of being a healthy model for some of these things goes a really long way. And so I don't want people to feel like you have to have a specialized training or, be a licensed independent social worker as I am to be able to do those things, because I think many, many people are capable and can do this really well. And we want, in several different environments, people to walk away feeling like they're capable of doing that themselves.
Yeah, Tawny, I think that kind of gets to our first audience question. They say, small story behind the question, my son just turned 18, and although we haven't dealt with a mental health concern, what would you recommend to a parent who is proactively wanting to know the steps of how to navigate this journey if a mental health crisis should occur, especially when most events happen on a weekend and organizations of care are lacking support and services?
I think a lot of the things that we mentioned are exactly the issue. To be preventive, as Tawny and Megan were saying, building community that is healthy for kids, being good role models, open communication. I think a lot of these things, as well as seeking out these wonderful crisis services that the state of Iowa has set up for both youth and adults.
And something that I would add to that too is it goes along with the training, but youth mental health first aid, just again, knowing when to, what is a mental health crisis and being able to triage and find the appropriate services, but also things that people can do at their house, or like in this case with an adult child who might be struggling, is again, that connection or learning some language to use a lot of affective statements, reflective listening to really empathize with the situation that's going on, look for safety and ways to connect, because there could be times where maybe there isn't something readily available in that moment. So being able to be the person who can be the listening ear, the understanding, and connect with someone who is struggling at that time as well.
Doesn't sound like in this particular scenario there are concerns right now about suicide, but we know that when it comes to suicide, being comfortable asking the question is just vitally important. Being able to ask, are you thinking about ending your life? Are you thinking about suicide? And so developing some comfort, and there are wonderful trainings that help with that. Living Works has a variety of trainings depending on kind of whether you're just starting out or have more advanced skills with mental health, but those trainings are often available in different communities as well. And I would encourage people to look into those if they're interested.
And to piggyback off of Alissa, we talk a lot in our line of work of creating sort of safety plans and things like that for those more crisis related moments. It's okay to just have an overall well-being plan of, we have a fire safety plan. If we don't plan on there being a fire, but what if there is, we kind of know what we would do and the steps we would take. And so I think it's equally important to have a proactive wellness plan of whether, again, conversations and check-ins and asking those more direct questions, or if this happens, who could I call? Who would be a good resource? What are those resources? I think is a really good plan to have. That's just it. It's a plan, right? And you may never use it, but at least it's there in case you would need to. I think it's really hard to tap into that part of our brain when we're in crisis mode. So to have it ahead of time can be really, really valuable.
Thank you for those suggestions, for that insight. Another audience question, how do you feel about young kids who plan to be social media influencers when they grow up? How do parents and professionals kind of curb this? Dr. Stevens, I see you smiling over there.
Yeah. Well, it reminds me, when I was growing up, everybody wanted to be an NBA star or an actress in Hollywood. So kids don't always have very realistic notions of what, not all children are going to grow up to be in professional sports or to be in movies and things like that. But I think what it taps into is what they're being, exposed to and what kind of captures their imagination. And I think, just as we used to, and we still do, when a child says they'd love to be in the NBA, we get them involved in sports in their community, and we tap into that thing that's captured their imagination, which, helps them grow as a person, helps them see what they can and can't do, and, learn a lot of skills in the meantime, and I think the same thing can be true for, social media influencers, talking to kids about like, so what is it about this that really captures you? Is it the fact that this person talks about cooking? Oh, wow, let's like learn more about that. Or is it because this person's very into art and fashion? Let's get you involved in things like that so we can tap into how much passion you have for this area. So I don't think we have to, just as I think most of my peers, families might have chuckled a little and said, probably not going to be in the NBA, but we're, that's a great dream. And let's get you on the court and see, that you can be part of a team, you can make friends that way, you can build social skills. I mean, these kinds of getting involved in community, as we were talking about earlier, can address the specific issue of the question, but also I think really build mental health resilience over time.
I would second all of that. I'm sorry.
Go ahead.
Because we wouldn't want to discourage someone or kids, goal because whether it's realistic or not, but I would really, encourage some of those visions of, well, what does it take to get there? And then some of those resources, activities that you could get them involved in that will help them not only just achieve that goal, but be involved in the community and social aspects, learn some skills that could be transferable. So if or when they reach adulthood and they decide they no longer want to be a social media influencer, they have some other skills or interests that could be suitable for other things as well.
Yeah, I think the other piece of this is like kids are getting involved in this at a younger age, whereas, we might have thought before you're going to be an adult by the time you might be able to get the NBA, where we have kids who are very young who are creating their own channels and getting involved. So I think it also comes down to just being very intentional as a family about what are your boundaries around social media, what kind of protections do you have in place to sort of safeguard your child, who has access to the things that they put online. And then most importantly, because we can't prevent everything, our kids are going to come in contact with things we maybe don't want them to at the age that they do. We need to be open and able to talk through those things. This happened. This maybe was a little unsettling or scary or uncomfortable. Let's process that and talk about that as a family so the child is learning the values of the family, learning how to be safe, that it's okay to talk when mistakes happen, that I can go and share with somebody and try to come up with a solution rather than potentially hiding it. So really making those safety plans around internet use and social media use really clear, and explaining like why do we need to do these things. If we just say, don't do this, don't do that, don't do the other, our kids are going to say, whatever, my parents don't know. They're old, right? But if we can give them really clear rationale and help get that buy-in of why we need to be cautious and careful when we engage in these kinds of activities online.
I am loving these audience questions. A great conversation. Another question, can you talk about how to support the mental health needs of LGBTQ youth? Tawny, would you like to start us off?
Sure. So, I think a lot of these things that we're talking about also, that would be for anyone across the board, right? We know that the LGBTQ plus population is probably lacking in some of these services and resources, unfortunately, throughout like our state. But I think we talked a lot, I know Alissa is talking a lot about finding safe, trusted adults or connections and relationships. I think anytime we can tap into who is a safe person that I can talk to about whatever it is I'm experiencing is going to be, the best probably first step in getting them to be able to talk about maybe some of the struggles that they're experiencing. What we know is a lot of these folks have probably had some negative interactions with whether it be adults or peers, that it's going to make maybe some of those positive relationships take a little bit more time. I have to be a little more patient, and with that, and knowing that maybe they've not always been received with open arms, unfortunately. At Tanager, we have the center, which is directly in support of LGBTQ plus community. And we do a lot of really, really fun events through Tanager, but we also hold, you know, some social groups. We have times that they can come together and process, build community. We have a therapist, Diener is our therapist that helps support that on a very consistent basis, and has just hangout groups for them to be able to, you know, just talk about, what does this mean for me? What are my experiences? How are they similar or different than yours? And what are other people maybe walking in a similar path experiencing? And it's really, really powerful. They're such a fun group of kids. I used to help support it and I had to step away when I took it, and I was so bummed, but they truly deserve just as much, if not more, of these services that we're offering. It's just hard to always find the places where it exists. So I hope it's something we're seeing more and more of, and knowing just like the shift. So yeah, that's what I would say about that.
Yeah, I know the director of the center, Lori. I've interviewed her for some stories. I've gotten to talk with some of the kids there for some of the stories I've done, and it's absolutely incredible the work that they're doing. The support the students who go there get. Phenomenal resource. Yeah.
Yeah, there are some really great organizations, of course, that are like make it possible to find people that you can feel that LGBTQ youth can feel comfortable around, and really have support from, like, PFLAG has a number of different chapters here in Iowa, around the country. They have great online resources. PFLAG.org is a really, really wonderful organization. There's one Iowa here specifically for Iowa, trying to address needs. I'd say specifically if families have transgender youth and are kind of new to that area, don't really know how to start thinking about it, there's a wonderful book called The Transgender Child, which can be very, very helpful in understanding the kinds of things that might be on the mind of a transgender child, or on, you know, the kind of questions that people in a family with transgender children might have. So those are some resources I would definitely recommend.
All right, another audience question. As a first responder, I would love to learn more about mobile crisis training, instructing, and public awareness. Here in Cass County, we see a large range of age within mental health. I believe this would be helpful in a pre-hospital setting. I also pre-take in the IUFA pilot project and oversee the Cass County host site, and feel this would benefit the first aid volunteers.
Yeah, the
So
mobile crisis, that is run through the mental health disability service regions. I know that there's currently a little bit of a shift, and some of those are being consolidated. So statewide, we're seeing some changes. So I don't know if anyone knows right now exactly how that will change, but there is mobile crisis across the state, and each region runs it a little bit differently. So I don't want to give anybody wrong information. So I would really encourage you to look at the region that you're in, and they have information online about what resources that mobile crisis unit is able to provide, such as whether they support youth, whether they go directly to schools, what the consent process looks like. So I encourage people to look into that to know more about that resource in their area.
But in general, for training for people who want to be able to do kind of crisis management, if they find themselves in that situation, kind of like we all, or not a lot of us, get trained in basic life support or CPR, you know, there are programs like what is actually called Mental Health First Aid, which is an organization that provides training for people to just learn the basics of mental health crisis intervention. And you can find those kinds of trainings online and in person. And then there's also trainings offered, again, in different regions by different agencies in ASSIST, ASIST, which is a really nice way for any community member to get trained in more crisis intervention for mental health. It's so nice to hear that a first responder is interested in like how to incorporate this and how to work collaboratively with others who are doing this work. So thanks for that question.
okay, next, Megan, did you have anything you'd like to add?
No, I would just second
sorry.
what's been shared.
Next audience question. What about support for Black Indigenous and people of color youth or individuals? What are organizations having conversations about regarding system support? So different than individual support for BIPOC. For BIPOC individuals and families.
One thing that's really important is trying to reach families and communities of BIPOC youth where they're at, and not necessarily always expecting that BIPOC families will feel comfortable to necessarily come to our hospital-based clinic or our clinic in this part of Iowa. Trying to get out there, which so many of everybody that's here on the call is developing services to be in different places, so that we're not kind of like, oh well, everybody will just come to the big hospital or some, here at the university, for example, including the university is trying to institute services out where families are. Of course, that includes BIPOC and non-BIPOC families, but I think in particular, simply because of history with BIPOC individuals not necessarily always having the access and the engagement with healthcare that we would want them to have had in the past. Those individuals don't feel sometimes feel disenfranchised from the kind of traditional ways of offering care. So offering things in schools or through telehealth, through community-based clinics that are more within people's comfort zone, I think is really, really important. That's one idea.
Something that I can speak to, which again is not exclusive to that population, more holistically, but I think also applies here, is going out to the community, outreach services, just as Dr. Stevens talked about, but looking at really intentional relationship building and building a deeper level of trust. And so utilizing providers who can be across various venues. So what I mean by that is I have a trusted adult who I see at school who helps me with these needs. And that same person from school might also be a person who does some social services support at my house with my parent. I might also see that same person in the summer months during out of school time, right? So we're being really intentional with having providers who are serving families out in a community setting across different venues, so that it becomes, less of a stigma to reach services, and that we have trusted individuals across different platforms, so that I can feel comfortable reaching out to one person and I can get me support in multiple places.
Well, thank you, audience, for these wonderful questions. Keep them coming. For now, let's talk about what schools are doing to support kids' mental health. I know Tanager Place is pretty ingrained with some schools in Cedar Rapids.
Yeah, Cedar Rapids and beyond. And so Cedar Rapids is by far our largest partnership in terms of a district. But we are in, I think, 11 different districts now. So we are also in the College Community School District. We're in Marion Independent School District. We go to Benton, Mount Vernon. Now we're, in West Liberty, North Tama, Monticello. So truly, we're really trying to make a reach to the rural districts because we know there's a lack of services available in those areas. So we're growing every year. And so that's a really cool thing. Obviously, I talked a little bit about how we have therapists in the building providing direct service through therapy or BHIS. Now we have a new piece of our school-based program where we have behavioral health intervention services also in the buildings. And so I think some of the other things that I'm seeing schools doing, and having worked in schools for a while, is really trying to draw in community partners to build up some of their peer support programs. So I think about Foundation 2, Green Bandana Project. It's a really, really neat thing. If you haven't looked it up, I would certainly recommend it. Essentially, Foundation 2 comes in and trains students and staff on how to be able to assess or help support someone that was having really it's about suicide, suicidal ideation, but it could be for anyone that's just really having a difficult time and might need connected to an adult or some sort of other support. And so then those individuals are accessible in the building, right? It might be a little easier for me as a sophomore in high school to go talk to another sophomore in high school versus my PE teacher. And so it's a way for peers to feel better connected to peers. It helps reduce the stigma about mental health, helps again build relationships, trusted, safe relationships with having some training and some education behind what some of those things mean. So I think any of those local community partnerships that help create access to resources is really, really rich and valuable in the school setting.
When I've been talking with educators and school administrators, I see such a strong desire to be able to do more for mental health of students. I think that's heavy on people's minds. And then the question is like, how? How do we do that? How do we have the time and capacity for that? How do we have the training for that? So I see a lot of schools are reaching out for additional training opportunities for staff to be able to do more of that, whether it's mental health first aid, or just working at building culture through having a trauma-informed lens, understanding, development and behavior from a mental health perspective and not solely a behavioral perspective, so that we are sort of changing the way we think about our interactions and our behaviors with people in the school setting, developing those coping strategies, as part of the learning that's happening in schools. And so I think we've got wonderful school counselors in buildings, we've got school social workers, we've got some school psychologists, and we know that not all districts have access to all of those supports. So I think there's been a push to find those alternative opportunities, whether it's partnering with communities or building up some of the training of the school staff in those buildings to support that. And I just want to give like a huge shout out to all those educators doing that work, because it is hard and it's on top of all of the things they're already doing, teaching those students.
Yeah, I would jump in to share a similar experience of what we're seeing schools do to support mental health is a lot of educator wellness too, and understanding from a trauma lens. So looking at those trauma-informed care trainings, trauma-sensitive practices, doing more like integrated SEL, so it doesn't feel like such a big like, oh, what do we do about it, but more of like these bite-sized pieces of connecting and modeling, teaching certain language, normalizing the conversation around emotions and feelings and feeling connected to people. So schools, educators as a whole are doing a lot more of that, where it's like just the changing mindset than even just a few years ago. And I think broadly that helps with more prevention level support when it again becomes destigmatized and everyone's kind of on the same page.
Next audience question. What type of mental health education or support do you see the biggest need for in our communities?
Oh, it's always so hard to pick the biggest need, honestly, so many needs. I really feel like I hear a lot, very often, that people want to, a youth wants to get into therapy, a family wants their youth in therapy and are having a really hard time finding an available therapist, which is really, really tough when somebody's sort of gotten to that point of wanting to start to get support, make change, and they can't find it. I really know that many people have recognized this need and the need to do something to try to increase the numbers of therapists, the availability of therapists, which are the just such a critical central provider for youth mental health. And a couple of years ago, Iowa actually did pass some legislation providing loan repayment for therapists, master's levels trained therapists who would practice in the state of Iowa, wanted to get trained in that area. Of course, a couple of years ago, probably wasn't enough time to have seen necessarily the fruits of that of that initiative. But I do think even more initiatives like that are needed. I think that it isn't just master's level therapists. We have a lot of in-home services, for example, in Iowa for youth that are offered not by master's level therapists through, behavioral health in-home services programs across the state. And so it'd be very, very nice for people to stay aware when the next legislative session comes up and maybe advocate even more for training for other kinds of behavioral health and mental health professionals who can contribute to that need for therapy for youth and for others. That's one thing that I really think is a big need.
Yeah, I think, we've talked about like suicide intervention training. I just would plug it again. Assist. If assist is more intense than somebody is able to do, it's a 2-day training. Safe Talk is another really good option. It's a half day. They're both through Living Works and they are great for suicide prevention.
Yeah, we've touched on some trainings that anyone, it sounds like, can take, are available in our communities. Can you guys talk a little bit more about what strategies people learn in those trainings, and any other ones you'd like to plug?
Yeah, I think like for the suicide training, like a lot of it is looking for signs, looking for cues that people might be thinking about suicide, and then being able to ask them directly and listen to them, to not be afraid, to shy away from having that conversation, and then from there, connecting them with the resources that are going to be able to help. So if you're, not a mental health provider, you're probably not the person who's going to be creating a safety plan with them. Possibly you are, but, looking at knowing what those other resources are, whether it's 988 or a local provider that you have a relationship with, the emergency department, and so on.
Yeah, I think it really depends on the training specifically, like Alissa just said, if you're attending a specific training. I know we have our Meraki Institute of Learning at Tanager, and so we do a lot of different types of trainings for a lot of different types of people. And so sometimes that could be a parent or a caregiver, sometimes it could be an educator, sometimes it could be a licensed professional. And so, I think no matter what the training is, I'm just very proud and feel very grateful that we have lots of, beyond just Tanager's Meraki Institute of Learning, but different types of trainings for all different types of needs, right? Even just like the first responder, right, that asked a question. I think that's really, really great. And I'm glad that people are asking those questions, because I think sometimes that is the worry is, are we getting the right information to the right people? Because one thing I've noticed, right, it's the people that probably already have some good skills and some understanding of trauma or mental health are usually the ones coming to the trainings. And that's really great to like increase and enhance those skills. But we also want the people that don't feel capable or comfortable to be coming to those trainings, to give them, the strategies and truly even just like a card of how you would exactly say this one thing to build up their capability. And so, we do have some really cool things coming up it's May Mental Health Month, as many people probably know. And so if you check out our website, you'll see we have a free resilience and mental well-being summit at the end of the month. Anyone can come to that. It's a really cool event for all sorts of different types of people. And I think most people would walk away feeling like they learned something, which is what always the hope is.
That's good.
For me, I was going to say, answering this question is a little bit more challenging for me for many of the reasons said, because each training has a specific focus or skills that you're going to take from it. But when I think about what we offer to educators and community members as a whole, there tends to be kind of this reoccurring, skill set or things that we like to focus on. And so generally speaking, those are shifting mindsets, right? So kind of destigmatizing the, oh my gosh, what's wrong with you, to how can I help you? So shifting mindsets, teaching people how to take perspectives of other people, right? And staying out of that judgment when they're hearing other people's perspectives, being able to be prepared with some basic counseling skills of reflective listening, clarifying statements, right? Asking more open-ended questions for probing. And then, as everybody else has said, having some knowledge of resources available in your community for that higher level crisis need. So I'm not sure that that speaks to the answer to the question fully, but when I think about kind of skills generally that trainings provide, that comes to mind for me.
Another audience question, and I just want to remind our audience, we have about 15 minutes left. So if you have any last questions, please pop them in the chat. Question, can someone make a career out of being an assist and mental health first aid trainer, or are these roles developed to augment our careers?
Great question.
Yeah, I think most people do this as an adjunct to a different, like they're already a mental health provider or something like that, and then they do this in addition. I mean, I know the person who kind of runs the Living Works trainings for this region, which I think is not just Iowa, it's like a Midwest region. And I think that has become her role, but I don't think there's a lot of people who that is their full-time position, if that's what the question was asking.
Although, it's interesting to think about the place that mental health first aid and these kinds of crisis trainings are at is maybe is similar to the place that, like we were saying CPR training was maybe 20, 30 years ago, where people were just starting it up. It was like a growing trend. And, there certainly are people now whose sole job is to do CPR training and that, although I think most people feel like they keep their perspective on how they can be helpful in that training by actually doing some more first responder work themselves.
Mm-hmm.
So it often is combined, but I have a real hope that this is going to grow as a big trend for more and more people to be interested in this training and for there to be more and more opportunities to be a trainer.
Another question, there only seems to be hospitalization, which is great for acute care, but what about kids that are not at that level but may need more medical oversight, such as when they're changing medications? Is there anything that Iowa has that is similar to subacute, or what do you think is needed here?
There certainly are some programs that are less intensive than acute inpatient hospitalization, but more than outpatient. There are intensive outpatient programs. They're IOPs, as they're sometimes called here in the state of Iowa. There are, for particular problems, depending on the age, partial hospital programs as well in the state of Iowa. So those can be nice. I do think that is an area that we probably could use a few more resources in here in Iowa. But yes, that's definitely a place where there can be more oversight and for, more rapid therapy intervention as well as medication intervention.
Are those types of programs available as much in rural areas? What are the challenges there across the state?
Yeah, I would say probably not, right? If I had to guess, I don't have any data in front of me that says otherwise, but unfortunately, probably not. Just thinking about where hospitals are located and what the resources are at some of those hospitals. I agree with Dr. Stevens that, I think this is an area that needs to grow tremendously. I don't know, what all needs to happen for that to be the case, but I know there's some crisis stabilization centers and houses. Again, those get filled up pretty quickly and they're hard to come by. I don't know if that's necessarily for the medication aspect of things, but a place to land that doesn't necessarily lead to, hospitalization. So there are some out there. They are trickier to find. And again, probably even more so in a rural area. But even in some of our urban areas, as we know, they're limited resources and they can get filled up pretty quickly or be hard to get into. So I think that's a hard place to always know where to direct parents and families, because if they've already had an experience, well, that didn't work or that wasn't an option for us, or it can feel really hard to want to try that again. And so I do think it's an area that could be really helpful to grow.
Do you see solutions there? Does it come down to more funding and more providers needed?
I think that's what it comes down to a lot of the time is you have to have the people, the space, the expertise, and the funding that goes into it. And mental health care is oftentimes not inexpensive, especially higher level of care. There needs to be a lot of personnel involved and oversight. So that is a challenge. And where do we put our values as a state. Like, do we want to put our resources into increasing mental health care?
I think this is probably the last audience question we'll be able to take, but what are your thoughts on defiant behaviors in adolescents? Is it becoming more common these days? And how do we relate to these behaviors with more empathy and not come across as judgmental?
It's something parents have been struggling with since the dawn of human families. Defiant behaviors in adolescents are part of the norm. Of course, it doesn't make them any less challenging for families to cope with. They're extremely challenging to cope with, even for someone with maybe the most wise perspective. So I think it's sort of what's already started by asking that question. It's seeking perspective from trusted adults that are in your life that you can say, wow, here's the struggle that I'm having. Maybe it's somebody you have as a parent with you in your family. Maybe it's another family member. Maybe it's a friend who also has a teen, or maybe who doesn't have a teen, who can take a step back and not be as immersed in the issue, to talk about the, like, how do I come at this? I think one approach that's very successful for defiant behavior that has been shown through research and clinical practice is to shoot for small improvements, not rapid 180 reversal change in terms of defiant behavior here and now it's gone, but simply improvements in defiant behavior, kind of like taking small steps towards the place you really want to be in the long run, but not with the assumption that a defiant teen who is sort of programmed to be a little bit defiant, that's kind of what all teens feel on one level, is that push to be independent, and it ends up sometimes clashing with the other values that are being instituted in the family, in the school, in other activities. So just trying to celebrate that it's better than it maybe the last time it happened. There was less, you could talk about it again after the blow up, if there was a blow up sooner, or there was actually a shorter blow up, or there was more acceptance of a compromise. Whatever that small change and that small win, it can be very, very difficult to handle. But I think that there's another good resource I'd just like to throw out there on this level. It's a book by Alan Kasdan. He's a child psychologist who wrote this book called The Everyday Parenting Toolkit, which kind of talks about that approach. He also wrote one called, and now I've forgotten the name. He's got a couple books with this focus on defiant behavior and trying to sort of move gradually towards success, which feels really, really hard if the defiant behavior is causing big problems. But it has been shown to be very effective.
I think these kinds of questions can be tricky because I'm immediately going to my psychologist brain and okay, what's going on? Which to me is, the next step is, what is happening? Is this just typical developmental process of, we're trying to separate a little bit from our parents and become independent? Or are there other things happening that are leading to this maybe moodiness or defiance? Is your kid sleeping? Some basic needs. Are they hungry? Are they, eating well? Are they having problems with peers? Is there something going on at school? So I know, with my own adolescent, she can push my buttons, right? And I want to just look at that behavior of that's not okay. But usually if I can then talk with her after we both calmed down a little bit, what's going on, there's typically something else. If it's not her typical behavior, there's usually something else going on, that it was an interaction with a peer that was really upsetting, or didn't perform as well on a test that she would have liked, and then being able to process that and step back and having that time to have empathy and work through what it is that's upsetting them can have such a profoundly positive impact, as opposed to adding on to, okay, I already had this bad day and this thing is happening, and now my parents mad at me, and then I have a punishment for that, and so forth. So I think being able to really talk with your kids and work on cultivating that relationship can help in some instances.
Yeah. Something that I would add, because it is challenging to speak to something so broad in that way without knowing more. But something that I would add that can be helpful sometimes is for the adults in the interaction to be able to maintain their own emotional regulation and use some brain-based responses for co-regulating for what is happening at the time. It's been my experience that sometimes with defiant behavior, building in as much ability within reason, within boundaries as adults, building in more autonomy and more collaborative problem solving for kids to feel like they have some ownership, and less power struggles can be helpful too. And I say that because it can be helpful, but I also want to be cautious that that's general statements now without knowing more of a situation. So those are just a couple of things that can be helpful with some of that childhood defiance and the adult part of that interaction.
In our last 5 minutes, can you talk about how people, the public, can support and advocate for the availability of more mental health services in Iowa?
Yeah, I know we've kind of referenced a few things, and so I don't want to sound like a broken record, but I mean, truly just promoting wellness amongst yourself and your circles and your interactions with people, no matter what you're doing in those interactions, I think is really, really powerful. It doesn't seem like it matters, but it really does. People pick up on that. And the other thing that I'll say, and I'll let the other lovely ladies chime in, obviously lots of good ideas amongst us, but advocating for policy change. We talked about how funding is so crucial and important to be able to bring some of these services to our underserved areas and just in general. And so not just saying like, yeah, I support mental health, but calling legislators, knowing who those people are, and advocating for the changes that we're all seeing a need for is super important. And it really doesn't take too much time once you have that contact. I promise it's not as scary as it seems. I was one of those people too. And I really just empower anyone to advocate in any way that they can through, again, policy work or just being a good person and showing up and supporting wellness.
And I think along those lines, Tawny, I just want to echo that and say advocating for inclusion of youth in every way we can. We want youth to be included in community with their peers, with adults in healthy ways. And that means, you know, making activities accessible to as many youth as we can. Sports are incredibly healthy. Clubs, for those who aren't sports minded, I was not an athlete myself, you know, but I got involved in lots of clubs as a younger person. Those can be very, very, and that they very, very supportive of mental health. And I just want those things to be available to all youth, LGBTQ youth, BIPOC youth, to feel like there are things they can be a part of. I think that inclusion can be very preventive for mental health.
Absolutely. I would also advocate, you know, we recognize that our youth spend a lot of their time at school. So thinking about what are ways that we can advocate for resources to be available at school for kids as well. Mental health opportunities, trainings for staff, you know, direct interventions, increasing, you know, school counselors, school social workers, and so forth. So looking at not just mental health as a, you know, a separate entity, but how do we integrate that wellness-based learning in schools as well.
Right. Well, any last thoughts from our panelists? This has been such a wonderful discussion. I've learned so much, and I can't wait to check out some of the resources you mentioned, and maybe even sign up for one of those mental health classes that you guys talked about.
Thank you, Grace.
Yeah. Well,
Thank
yeah,
you.
thank you for the discussion, and thank you to our audience for your insightful questions. They were truly amazing. And thank you again to our presenting sponsor, ITC Midwest, for their sponsorship on all things related to Iowa Ideas in 2024, and to this week's in-depth presenting sponsor, Foundation 2. Don't forget to check out tomorrow's conversation at noon, supporting Iowans in crisis. And don't forget to save the date for the full Iowa Ideas Conference, October 10th and 11th. And that is also virtual and free. So thank you for joining us. Have a wonderful day.